Are you looking for a podcast where you can hear from real people regarding their real dental drama? If so, then you've come to the right place. Join hosts Bethany Petty and Dr. Rena Kuba as we dive into the solutions we've created and the mistakes we've made while managing dental drama. Let's get started.
What's up, friend?
Hey!
Well, this is exciting. Another live podcast.
What is it? People wanted to see us again.
I
bless
don't
them.
get. I've never watched a live podcast, so I don't know. Maybe it is like watching Oprah, though.
Yeah.
Are we like Oprah?
Please say we are. Those of you watching,
Lord.
please
Okay.
compliment us and say that we have an
Like
Oprah quality.
Yes. No, but you know what I mean. Like watching people talk. But it never occurred to me that people would. When you first proposed it, I was like, okay, that's special.
Well,
and different.
And it wasn't even me. It was Sarah, the brains behind the operation, that was like, y'all really need a video. And I'm like, really?
Yeah.
And here we are. We heard from so many of our listeners that were like, I loved it. I loved getting to see you guys.
And thank you guys. That is
It
very
really-
sweet and made our day. And so here we are.
Back
in, without planning it, matching shirts.
We showed up and are in sync already. So that means that this podcast is going to be
okay, no pressure.
Mind-blowing.
Before we get started, I did, I don't know if y'all can see this or not, but I've got my Texas earrings, and I was intentional about wearing these.
Okay.
Because I wanted a reminder to everybody that our leadership Summit, thank you. Our leadership summit in September is booked, ready to go, ready to be signed up for. So come on over to Texas. We're welcome to invite y'all on over and come join us down here in the South. And yeah.
Just, Texas in and of itself should be worth traveling for. But
Yes,
then to get
yes,
these two bozos, I mean.
Yes. Yeah, it really is funny how many people still have ideas about Texas.
Yes.
And like, are there really horses everywhere? I'm like, well, maybe out here in your next. We're at Bethany's farm right now, and so maybe there are the horse and buggy I passed on the way here.
Oh yeah,
but
yeah. You might hear some come through the mic here in a minute. The neighs, get ready.
Anywho, so please look up that information if anybody's interested. And this, the topic I want to talk about, kind of ties into that because I think, signing up for continuing education courses, trying to decide where are we going, who are we taking. I know we've had a few podcasts on that before, like, the costs can add up. And if you've got one person on the team that kind of can not be as, you're afraid of the harmony and the culture being affected, all that. Yeah. Anyway, so I'm kind of getting off track here, but the point was, each member of your team, bring everybody, and I'll touch base on that more later. But what I wanted to talk about today was about the team. Do you have, how do you disperse tasks between team members? Is it just the manager that, if you have a manager, is it the manager that's doing most things? And then if it's an RDA, are they just doing RDA tasks? If it's, do you have people that are cross-trained? And who owns different tasks? So I don't know if there's a better way of saying this or asking this or whatever, but and I'll of course come to where I wanted to talk about this or what made me think about this. And then when I mentioned it to you, you were like, we've never talked about that, and it does come up.
Which is crazy because it's so foundational to your practice, to a lot of practices that I work with, and I was surprised. I'm like, why have we not talked about? I call it directly responsible individuals. Why have we not talked about that on the podcast? Because I think it's so pivotal to raising up a good team, having invested team members, reducing stress on the plate of the practice owner and manager. So, yeah.
So I've already, in true fashion to myself, have been all over the place. So just to kind of come back and be more clear about what we're talking about here today. The point was, like, are your team members, equipped to take on tasks that are helpful for the practice? Are they interested in helping with different things outside of their roles? What are the benefits and maybe disadvantages of farming out tasks to people? So I think that's where the tendency is, at least I would imagine, or possibly where I was early on, was I don't trust anybody in my office to do anything. I've got to do it all myself.
Mm-hmm.
And I think that's pretty common for especially new owners.
Yeah.
And then you hit a point where you're like, I am just burnt out. What was I thinking? What was I doing?
Yeah.
And those early years, years 3, 4, 5, where you're, whatever you started has changed by year 3 or 4 because your systems worked when you only had this small, tiny patient base. But then you grow, which is what you want and is a good thing. And then you get to a point where you're like, this doesn't work anymore. We've got to change some things. And then now you've got more things to do. And do you have enough people to help you? Do you trust those people? How do you equip those people? You're almost burnt out yourself. I think for us, it kind of became a little bit more natural in our flow once you brought in the concept of team leads.
Mm-hmm.
And so for me, where I like it, and like it meaning like having different people responsible for different things. Well, before I get into what I like and why I think it's a good idea, let me let you kind of chime in here. What do you...
So
like you got excited about this topic, so tell me what you
really did. And so there's several things that I like about this topic. That you mentioned the idea of a young practice and it's not as necessary early on. But in all honesty, this idea of having different people responsible for different tasks is beyond just task management. So even though the plate might not be overwhelming early on in a new practice, it's still the idea of if you give people responsibility, then they will hopefully rise to the challenge. And maybe this is a way of explaining it. If we just have people that are showing up, clocking in, and doing the basics of their job, over time that gets to be mundane and monotonous, and it doesn't inspire creativity. I almost think of like if somebody were to show up to an assembly line or a factory and just do the same exact thing over and over again, at some point that's boring. And so there's something exciting about the idea of passing off tasks and allowing somebody to become the expert in that. Even if we have the capacity as a practice owner or as a team leader to handle it, we're actually telling somebody, I believe in you and I think you can do this, or I think you can become the expert on this, or you have a capacity to grow in this area. And maybe it's not directly related to assisting or directly related to being a hygienist. Maybe it's practice management and you're not a manager, but you seem to really be interested in this, and I want to give you the opportunity to do that. So I actually view it, yes, it's helpful from task management, but it's also something that is inspiring and ends up creating teams that I think are more on fire, higher caliber teams, because there's more expectations of those team members.
Which is counterintuitive in a way. Like I think for me, my hesitation always is, well, are they going to be like, what else do you want me to do?
Yeah.
Although then you do hear, like, if you go outside of dental things and you look at just, any corporation or anything, they're always like, delegate things to your team, let them feel, quit micromanaging, let them get their footing in the ground and give you their opinions and do all that. And I will say, has it worked out all the time? No. I have had people that are like, it's too much. I don't want to do this. I just want to do my assisting and go home. Or or is it everybody's fighting over what they deem the glamorous tasks? Mm-hmm. Nobody wants to be in charge of all the OSHA compliance. Everybody would rather do the marketing, whatever.
Yeah.
Nobody wants to be in charge. So there is some fine tuning there. But I think what I like about the DRI, directly responsible individual. Okay. Mm-hmm. I mean, to me, it's like, who's it on this task? Mm-hmm. And what I like about that is it's really helpful in downtime. So if you're a clinical person and now spring break is over and it's testing week at school and we know there's like 5 patients on the schedule.
Yeah.
Rather than send everybody home, everybody has their tasks to work on. Mm-hmm. So for example, in my office, the one who gifted me these lovely earrings, and I guess if you're not watching this podcast, it's Texas blingy
Yes.
Texas earrings that I've
Oh,
got
yes. Yes.
on. And so Natalie gifted me these. Anyway, Natalie is now like my something even as simple as the uniforms we're wearing in the office, because we change, like we have an office shirt that we wear for a couple of months and it changes every year. And then we've got like if I see a cute shirt, I'm like, hey, y'all want to wear this? Let's incorporate this. It's like in the fall we do cowboys on Fridays. So are we doing cowboys with black scrub bottoms? Or are we doing cowboys with jeans? Well, it depends. What else are we wearing the rest of the week? All of that. I'm like, Nat, you're the coordinator.
Yeah.
Nat, you tell us what we're wearing. And so if somebody comes and asks me and says, hey, what's the uniform? I'm like, I have no idea. And I don't want that on my plate, first of all.
Yeah.
Second of all, like, I don't really care. Just show up covered. Like, I don't care. But from a polished looking perspective, I do have team members. Thank goodness somebody cares, right? And team members that are like, no, we need to look more cohesive. We do? Okay. Well, then who's in charge of that? I don't want to have to micromanage that.
Right.
And be like, the rest of us wore our pink shirts and you wore blue. Like, Nat, you're in charge of that. You're in charge of making sure everybody knows. So literally even the other day we had our patient appreciation event on Saturday, and so on Thursday, Friday, whatever, one of my kids was asking something, what time will we be done, or what time will we be home, what time do we need to get there? And I'm like, I don't know, hang on, let me ask Nat. And my kid literally snickered. She's like, yeah. And I was like, what? And she's like, I just love how Miss Natalie knows more about your events than you do. And I was
And you're like,
so,
as it should be.
as it should be. Like, I literally, this is our one big event of the year. We do a lot of little things. It's our one big event. Our patients know about it. We spend a lot of money on it. And I show up. I don't know any about, because we've done it now. The same people are in charge. They knew what worked the year before. That even when I got there, like, somebody had an idea and they're like, oh, we need to do this next year. Okay. They're going to look it up. They're going to bring me the costs. They're going to bring me all of that. And I'm going to let them.
Yeah.
I'm going to let them. Great. That's your idea. If it's not ridiculously cost prohibitive, and it's not, if it makes somewhat sense, even if it's something that I wouldn't necessarily care about, but I'm like, great. It gives them this feel of authority, ownership, pride. Like I said, it's not all the time. I've had plenty of, I had a manager once that kind of got burnt out on it and didn't like all the extra. On the other hand, she did like that there were a lot of things where I was like, I'm not doing that without checking in with her. So it does give that. Now you've got to foster that, and how do you let go? I think that's a problem for a lot of us, is how do we hand over the reins? How much? I can't just be completely hands off. I've got to have some toe in this. But for me, it's like, okay, if I'm doing 20%, you're doing 80, that is a huge win. If I'm doing 60%, but you covered 40, great. That's 100. That's, 40% I didn't have to do. I didn't have to do 100% myself.
Exactly. And I think you're exactly right. You said the word ownership, that I think is important here. Anything that we put our name on, we often feel pride in. Like, you think about kids bringing home assignments or projects that they did and how excited they are to show, like, oh, look what I did. And it's almost like that childlike tendency that we have to create something that's cool that we did or that we were responsible for. It feels good. And that feeling of ownership is something that we want our team to feel as much as possible. Maybe it's not a daily thing. Maybe, even though I know this is not true about Nat, but if Nat only did the Patient Appreciation Day event, then that means for a few months out of the year, she's feeling really good about herself because that's her only task. I know that's not true, but if it were, it's like at least for a few months, she's got a break, so to speak, from her only value being an RDA. And then she gets to be responsible for and be recognized for something else. But to your point, I think it can't just be like, I'm done with this task. Here, Nat, it's you. Take it and run with it. Because she has a greater chance of failing at that task, which is counter to what we want to create. So we've got to think about this DRI program or concept as something, as a way to get things off our plate, but also a way to build the confidence of somebody else on your team, which means you have to give them a recipe to follow, or at least direction, so that what they create is something that they're proud of. And also you're like, that was a job well done. And so sometimes it takes time to figure out what you're going to pass off and how you're going to pass off. And you have to actually invest the time to make sure that you've got meetings with them. Let's say that you always manage the Patient Appreciation Day event and you're finally handing that off. There's going to be a lot of stuff that you know that needs to be transferred over to whoever has taken it over. Or heaven forbid, Nat moves to Canada and she needs to pass it off to somebody else. There either needs to be built-in redundancy, which there is on your team, where Nat's not the only one that does Patient Appreciation Day, but there's other key team members that are involved with it, or Nat would need to set somebody else up for success in that.
So now you mentioned the redundancy. So I think the other benefit of that is, if somebody ends up in a car accident, somebody ends up moving, somebody, whatever, that you're not reinventing the wheel every time, or that you're completely stuck because that was the only person that knew where something was. Like, I never like to find myself in that situation. But also, I think this is where personalities, you knowing your team and their personalities and their strengths and weaknesses really starts becoming helpful and important. So say Natalie is a super, she's not, but let's say she's a super, like, phlegmatic. She's not a phlegmatic, but if y'all remember, phlegmatic was like kind of you're more laid back. I'm not getting ruffled. I'm going to get my system. I'm going to get it going. But a phlegmatic typically has not so great sense of urgency.
Yeah.
Tend to be more path of least resistant.
Slower paced.
Not great communicators.
Yeah.
So if that was Natalie, so then she's got everything in her head, and then now she has to move. Or let's say she's not moving, but now the rest of the team, she's got this great event planned, but the rest of us didn't know to tell patients about it because she never told us.
Yeah.
Because she wasn't a great communicator. I think this is where, when you do have, like, okay, Nat's lead on this, but who are Nat's assistants?
Yeah.
Who are Nat's sub people? Because I feel like, I think almost any task we have in the office, it's really one person doing it. We're going to miss a better way of doing it. And it's all, I mean, even like with me, if there's something that I'm doing, I'm like, okay, well, I can do these parts of the task, like these 7 steps of the task. I think I've got these other 3 I'm going to struggle with, regardless of what it is. So who's my, even treatment planning? I'm looking at these x-rays. This is what I'm thinking. Hey, this is why I love working with an associate. Hey, Dr. Lee, can you look at this and tell me what you think about this? Even though I've got many years on Dr. Lee, he's been practicing about 3-ish years now, 3, 4. But to me, that's still exceedingly valuable to get another set of eyes on something, right? So it's good to have like a backup there. And so for the things that Nat's going to do well, but then the things that, say, Nat is not a super organized person.
Yeah.
And she's going to forget these couple of details. Having somebody else in there with her. So now 2 people know what's going on should one person get sick or move or whatever. But it's also, you're using the strength of multiple people.
Yeah.
Now,
and pairing properly with that, because I think, to your point, if Nat's a phlegmatic and not a great communicator, then the second person you would want involved in that task is a high communication person, which then balances out the potential weaknesses of Nat, and then also it creates that built-in redundancy where Nat's not the only one that knows about the details, but we've also got another person. So again, kills 2 birds with 1 stone.
Yes, I agree completely. I forgot what I was just about to say.
Sorry.
No. Anyway, this got brought up in, like, what I was telling you, and you're like, we haven't talked about this. So this was just yesterday. We have a team member that at sometime in the fall had said something about possibly getting another job because she needed more hours. And I was like, whoa, before you do that, like, there's always stuff to be done around here. And then we found out at the end of January, that we have one of our main front desk who's leaving, going to go have her baby and then not come back to work. So I was like, okay, what do we do here? Who else do I have equipped in the office to be able to help at the front?
Or potential of being equipped.
Right. Yeah. And or do I need to hire somebody else? We're pretty heavily staffed right now, but we were very clinical heavy. We've got 4 part-time hygienists, At that time, we had 5 RDAs. We also had the 2 offices. We shut down the 1 office, right? So it's like, okay, I've got all these people, but none are really equipped. They're not full front desk people. Okay, well, do I need to get full front desk person?
Right.
I don't know, Bethany. What do you think? Okay, now let's look at who we have. You have done, answering phones before in another office. You have done insurance verification in another office. I have no idea what you know and don't know, but maybe you would be good at this. Maybe you wouldn't. I don't know. You don't know either. Okay, well, let's see what happens. Then we did our compensation reviews. What are your goals? And it came out that there were certain people that needed more hours.
Yeah.
Okay, so to me, I'm like, could we kill multiple birds with one stone rather than having to hire a whole new person, which y'all know how that goes. Like, where am I going to find said person? Then am I going to be able to afford them? Then are they going to be able to learn our systems? Then are they going to be a nice culture fit? I'm just like, ugh, I don't.
It's exhausting.
It's exhausting. I don't know that I want to bring somebody else on right now, especially when the one we're losing is so pivotal.
Yeah.
She's so adored in the whole office. Like, whoever's going to come in is going to have huge shoes to fill on multiple, like, not just from a knowledge standpoint, but from a culture standpoint. So, so I'm really wary of bringing somebody in. Okay, can we make this work? We've got about 3 people here that want a lot more hours. These 2 have had some front desk experience. What could we do to train them up? What can we do to, even if they're not ever going to be full proficient front people, which they don't want to be, they're clinical people and they would rather do that, but they're willing to step up and help to get the hours. So now we're going to play. We're going to play and see how much can we train you on? How far can you get us? Might you take over 100% of the insurance verification? Probably not. Could you do 50% and save the insurance verifier 50% of her time? Maybe. Let's try it. Anyway, so as we're going along, one of the RDAs who had initially said in the fall that she wanted more hours, when you come back in January, and she's like, well, actually, my kid made the volleyball team and my sitter this and blah, 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 that. So I actually can't pick up all of these extra hours. Okay, well, the reason we put her to pick up more front stuff is because in previous jobs she has done a lot more variety of front desk stuff, and she wanted the hours. Well, now she doesn't really want the hours anymore, and I've got 2 others that do. Great, let's swap y'all out. And you 2, I can't promise how long I'll keep you in that role. It's going to be how well do you learn it? How many mistakes are you making? How many times do you have to retrain you on the same things? And from your side, when are you going, oh yeah, I'm gung-ho, I'll learn how to make estimates. And now you get in there and you're like, I hate this.
Yeah.
I'm not good at this. So all with the understanding that we're all playing and experimenting here. You keep me posted on what you're thinking and what's making you miserable and what you want to learn more about. Maybe you love insurance verification and that never occurred to you, never thought you would. So let's continue to explore. So anyway, that's been going on since February. We're now in almost May. And I've had one team member that I've heard just little rumblings here and there. And I'm like, I don't really know what to make of this. And my thought was, is it time for her to go? Is she being a pain in everybody's side with just her little commentary here and there and kind of some remarks that, or is the team being too sensitive? Do they just not like her and now they're picking on her? I'm trying to explore, figure out where all that's going. So, yesterday she came to me at the end of the day and was like, oh, can I talk to you? And I never like that, right? To me, I'm like, oh.
Anxiety inducing.
Yes, talk to me. Like, what is it? And, we'd had a long day. I was like, okay. And these things are never quick. Can I talk to you for just a second? It's never quick, right? Whether that's my fault or their fault, I don't know. But either way, it's never quick. And so I was like, I don't know. We've got this emergency patient coming in. I don't know if I have time for this. You're just going to have to find me later. But in my mind, I'm like, I think she's quitting. I think that's what's happening here because I've been hearing about these rumblings for about 3 or 4 weeks. And I need to, and maybe it's good. Maybe it's good. Off you go, because if you're irritating the rest of the team and you're destroying the culture, maybe it's time for you to go. You're telling me you're giving me your 2 weeks, which kind of sucks because we're about to hit summer. Whatever, fine. Just rip the Band-Aid off, get it over with. So I kind of didn't want it to linger and fester though. Like if she's about to quit,
better for you to know sooner
than later, and let's figure out a plan and whatever. So we dealt with the emergency patient. We're about to leave. She was briefing me on something. And I said, hey, do you want me to text you? Like, what did you want to talk about? and I had to get out of there too. So I was like, I don't want to open this huge can of worms, but if you're about to quit, say I'm quitting and end of story and I'll be on my way. So she said, yeah, I can tell you now real quick. I mean, it shouldn't take that long. So already I'm like, okay, it's what I was thinking. And she goes, well, I feel like I'm not really part of the group. And so that's not what I was waiting. So,
Yeah.
Or I was almost kind of like, okay, so that's her segue out.
Yeah.
Like, I don't feel like I'm embraced here, so I'm out. And so I kind of was like, what? And she said, well, like the two girls who are now taking over front stuff, they have their things. And then Natalie has her thing. And, I help the front person, confirm calls and do this. I help so-and-so with the retention reactivation calls. I help so-and-so with whatever. And then I finally stopped and looked at her. I was like, so what you're saying is you want your own task? And she's like, yeah, I want my own task. Which, Bethany, I kind of was like, I had that completely wrong.
Like, how did I miss this?
But I just wasn't expecting that from her. And so I said, okay. And then the more I thought about it afterwards, I was like, in the fall, we kind of told her she would be the one to take on more of the front. But then, like, with her cutting her hours and then some rumblings, and she wasn't getting along with the other front person, and she wasn't getting along with this RDA, and now she's not getting along with that RDH, and I'm just like, you're just causing trouble. And now that I think about it, I think it's her. I think she feels like she's the peon.
Yeah.
So it's like if Jenny took over, doing whatever, confirming patients, and now Jenny wants to do this, hey, you take over these few.
Yeah.
Or you do sterilization because I've got this. Or you get to see the last couple of patients because I've got my marketing task to work on. And I think she was just, I'm betting, she didn't say it, but the more I thought about it, I'm like, I'm betting you anything. She feels like I'm just the grunt work person.
Yeah.
The stuff that nobody else wants to do, that's what I'm getting. I'm being punished for some reason. And is it just because I wanted to cut some hours back? And everybody else has something, but I don't.
Yeah.
And I was just like, oh, well, I love that. There's always things that need to be done.
Yeah.
So you're telling me you want to be the responsible one and you want to have your tasks. Yes, that's what I'm saying. Okay, well, I love that.
Yeah.
So,
which shows the lack of it, right? So it's like when you have a team that you've had this concept for a long time of this person does this, and those are always in flux too. You might add something to somebody's plate or say, hey, I now want you to learn this. So that's been such a part of your culture that she was recognizing I'm not included in that.
Yeah.
And I think you and I were on the fringes of thinking, is she in, is she out? And therefore we're not passing tasks to her. And then therefore we've got some of the grumbling or the negativity from her because she feels like I'm unimportant on this team. I don't have something that's mine.
And it was like flashback 6 months ago, it wasn't like that because the other two RDAs that are now more front and center, at that point, we didn't know that so-and-so was leaving. Yeah. So we didn't need that. And so, like, Natalie has certain, because Natalie's my longest RDA, so she's got her things. And then the other two RDAs kind of have, like, they help Natalie with stuff, but they're not primary on a lot of things. But just since January, so now 3 of the 4 RDAs have their thing, and she's the one. And I think that's where a lot more of this has come from.
Yeah.
And so I just was like, I totally missed this.
Yeah.
I had written her off. I thought she was quitting.
Yeah.
So anyway, I told her, I said, hey, yes, make your list. Give me a list of things that you think you would be good at, things that you would want more information on, and let me see what we can put together for you. But I love the initiative. I love that you're willing to help.
Yeah.
And if that's what you're ready to do, I think that's fantastic. The other thing for me, it's always in my mind, it's longevity. Mm-hmm. If you feel like you are important, if you feel like you are invested in a practice, you are going to want to take over something and nurture it and guide it. And like we all brainstorm together on this. And so you do have some ownership in the practice as opposed to I'm just coming in and clocking in and out.
Right.
And so I was very pleased
Yeah.
that and I'm hoping we see a turnaround.
Once she has that confidence boost of like, oh no, they're happy to give me something. And some people don't, I think your suggestion is really important here because some people are like, okay, how do I do this in my practice? Where do I even start? And it could be something as simple as have each team member make a list of things that they're really interested in learning more about or areas of the practice that they feel really confident, like they know a lot more, or areas of the practice where they have ideas. It could be as simple as, hey, what are some of the ideas that you've had for the practice over the last 6 months? And even just seeing what ideas they've had can give you an idea of what they're passionate about. So it could start with just that kind of dialogue. It could be a sheet that you have them fill out, and then you're evaluating it and going, okay, what do I see in this person as potential, and how then can I assign tasks accordingly? And I would say start small. If you haven't done this concept, then it's like we may want to start with one task or one area of expertise and just let that brew for a while so that the person doesn't feel overwhelmed by all these additional tasks, but feels excited about it. What I love too about this concept is you mentioned it earlier, and I wanted to come back to it when your daughter asked you, what time are we supposed to be there? And you're like, oh, I don't know. Let me ask Nat. The idea of DRIs is that there's always a point person that is an expert in that category. So I've got a large practice that I work with, 28 team members, no manager, no leader on the team, but each department, hygiene department, RDA department, business department, every single person in that department has a responsibility or something that they're expert in. So while we don't have leaders or managers in the practice, there's trainers in each department. So a hygienist has a designated trainer, RDA, and business team. And this trainer is responsible if somebody new comes into that department, they are the trainer. But also, they set up monthly meetings for each department. So they're the ones, like hygiene department has a monthly meeting. The trainer is the one that puts that on the schedule, communicates to everybody, and puts together an agenda. So they gather topics from the other hygienists on the team, put that into an agenda. They gather topics from the doctor, put that into agenda. So they're not training in that meeting, but they're organizing the training. So then if somebody's like, hey, when's our next hygiene meeting? Oh, I don't know. Let me ask the trainer. And that's just one position in that department. Everybody else also has expertise. And so to me, this concept works microscopically. If you've got a team of 3 team members, like doctor, assistant, business team, there can still be this concept of, oh, I don't know, that's going to be Sally's department. Oh, I don't know, that's going to be Susie's expertise. And you still develop this idea of, let me punt to this person. Because I think one of the mentally exhausting things for a practice owner or a manager is that you're always the person that's on the receiving end of the question. So I don't know if y'all's family works like this, but I and my husband can be in the same room and the kids all come to me with the question, hey, mom, this, hey, mom, that, hey. And I'm sitting there and I'm like, looking at my husband like, hi. And so finally I'll say, I don't know. That's your dad's area of expertise. Or I don't know anything about that. You're going to have to ask him. So I deflect and defer, which is so freeing in the moment because a lot of times they're coming to me with questions that he would be better suited to answer, but they just naturally come to me. So for the leaders in the practice to have somebody go, I don't know, that's better suited to go ask so-and-so about it. They're going to get a better answer because that person feels like that's their domain. And also, every time that team member is asked a question from somebody else, it's confidence boosting. Like, I do know about this. This is my area of expertise. So I just think whether it's a small team or this works on very large teams, it's a good concept to have in
I
place.
think what would make me nervous if I was listening to somebody, if I was listening to you say that, is especially for the small office, well, any size. My fear always is, what if that person leaves?
Yep.
Or what if that person moves or whatever? Um, especially if you're a small team and you're like, man, like I already have Jenny who is having to answer the phones and do the marketing and chairside assist and call the lab and do all of these things. What more can I put on her plate? And then what if the um, corporation down the street takes her and now all of my eggs left there? I'm going to suggest that can happen, but that's where we talk about having your built-in backup.
Mm-hmm.
So if you're a smaller office, it may be where you're just like, there is no way I would send Susie out to go market.
Yeah.
There's no way. That's not going to be in her wheelhouse, whatever. But at least if she knows some of the system and can get the marketing basket teed up because she knows what Jenny used to do.
Mm-hmm.
So it really does, it can still work.
Yeah.
I think I remembered what I was going to say before was the other reason I like that point person
Mm-hmm.
is because if nobody owns it, if everybody owns it, nobody owns it.
Mm-hmm.
And so for me, it's like, hey, can you three RDAs work on, I don't know, the compliance binder of making sure everything is, the expiration dates on all the products are still good. And then you come back and you're like, wait, who addressed this one? Oh, well, I thought she was doing it. Oh, well, right? Like we just experienced that not too long ago. You came in and you're like, hey, we're going to do this campaign in April, May to boost patient because April, May is very slow in our office, in a peds office. And then we realized like we just kind of sent the email, but we never gave a point person. Like you are in charge of this. Not that that person is the one who has to do all the steps.
Yeah.
But you are the one who, if you are going to create the marketing flyer for it, but then so-and-so is going to be the one who, the AR person needs to know, because if we're offering discounts on sealants, she can't turn around and bill the patient for when they came in during the promo time. So it's like, who is doing all of these little pieces? So you're the head of this octopus. Doesn't mean you're doing all the things. The little tentacles are busy doing stuff, but at the end, you are the one, whoever's your DRI on that is the person who's in charge of that.
And ultimately responsible.
Yes.
And your point person. They're the ones that are focused on the deadline. And even if there's subtasks that have been delineated out, ultimately they become the person responsible for those. So it does create clarity, which again allows people to be successful. If they don't have clarity or don't know, am I the one doing this? Or then they're unsuccessful in it. So I do think having it clears up communication. It really does. And I think that alone makes it worth it.
I think the next thing that people might be thinking is like, I don't know, like what if the phlegmatic one is the one that's like, oh, I'll go out and do these marketing baskets? Or flip side, what if we're like, the only one really with more time on her plate is Susie who would go. We're not going to set Susie up for success if we go send her out. If she's a phlegmatic and she's not your natural, like, let's go meet people, I'm excited about this, then Susie's going to fail. Susie's not going to want to do it. It's not going to be done well. Then you're going to sit and wonder why, like, we did all these marketing efforts and none of these people are contacting us. Well, yeah, because you sent a dud in there who didn't really engage with anybody, just kind of dropped the basket there, didn't go over, hey, we're a pediatric dental office. This is what we specialize in. This is what we can help you with. This is what... She just dropped off the basket and left.
Yeah.
Well, that was a waste of time. Now, to me, it's like, am I sending my most sanguine team member out? In my case, most of my sanguines are not detail-oriented. So they're going to go out there, but then they're going to forget to put in like business cards in the basket. Again, you connected and you chatted with that other front desk for 45 minutes. Y'all are besties now. But does that person even know where you came from?
Yeah.
They have no idea you came from Kuba's office. You could have been from the pediatrician for all anybody knows. Yeah. Because you weren't strategic in your... So having to... Sometimes, it's like, do I need to like double down on this? Like I've got to pay 2 people to go do this now? May as well just do it myself. I think that's where we... And that's not... Try to find the people. So like if you know that Susie's going to be the one who's going to be more diligent and like going, hey... Jenny's going to forget the pen. She's going to forget this, forget that. Susie's getting it ready. And then Jenny, you're going, and these are your talking points.
Yeah. That's, to me, we have to attend to natural proficiency with each person. And whoever the phlegmatic personality is can still get the prep work done, where your super sanguine is not going to be good at the prep work. So they can still be involved, but ultimately you're sending out the person who's going to be successful in it. And I will say, on a super small team, if you don't have enough of a diverse personality, it's like, okay, maybe you can't pass off marketing. Maybe as a practice owner, you know that unfortunately you're going to be the only one that's equipped to go out and market because the others are not personable enough. That's okay. Pass off what you can. Say, hey, I'm going to go out marketing. I'm going to be dropping off to this, this, and this. Can y'all put together some ideas on what I can drop off? And let's meet on that next week. And you can bring your ideas to me. Okay, these are your ideas. Great. I actually like this idea. Can you go ahead and go order that? Get that ready to go for me. So they can still support you in it, but maybe you're the only one that's equipped to go out. So that's another thing to think about, is not everything has to be passed off. On a large team, I would say absolutely. If Sally's not equipped, there's going to be another person that can be equipped, and you can pass off a lot more. But on a small team, even if you're passing things off your plate that then free you up to go marketing more, that's still a win for the practice ultimately. Any other thoughts on this?
I think the only other question I had was like, what if Jenny thinks she is really good? And now, Doc, you're not listening to my ideas, and I suggested this, but you didn't like it. And in my mind, I'm like, yeah, that's dumb.
Yeah.
Because that's either going to cost me too much, or flip side. Like I once had, this is early on, and I said something about, can you stop by this office? And I was very specific. We have Einstein's bagels down here. Take a bagel bucket. These are the cream cheeses. Like, go take this to this office. And then like the next week, whatever, the person, my staff of one, she went out and dropped off, and she said something, and I was like, wait, what? And she went to Walmart, grabbed Walmart sugar cookies and took that. And she's like, well, it was far cheaper to do that.
Yeah.
And in my mind, I'm like, I'm supposed to be the specialist in town.
Right.
I can't take Walmart sugar cookies. And I guess you can, but that's not the way
It's
I
not
wanted
the impression you wanted to leave.
That's not the impression I wanted to leave.
Yeah.
And so how do I not crush her? So what do you do with people that my ideas are never taken, or I'm the one who's good at this and the rest of the team is like, she's not the one that's good at it? What do you do with that?
So first of all, I can't tell you how many times that happens where somebody goes rogue and pivots and does their own plan. So I do think it's important when you're establishing, I'm going to pass this task off, that there is documentation of what y'all decided on. Whether that's a quick email, hey, for deliveries next week, and whoever your person was should have been the one to send the summary. Okay, so Dr. Kuba, this is a summary of our 10-minute conversation. I'm going to take Einstein's bagels and these cream cheese to this, and this office. So it's a way of confirming, yeah, that's what we decided upon. So I think documentation protects you in a lot of those. We've got to be careful that when we pass off, yes, we listen to their ideas, but they need to know from the beginning, this is going to be collaborative. We're feeding off of each other, and I want to hear your ideas. You also need to be hearing my ideas, and then we will settle on something. Once we settle on something, you're responsible to document that, send an email so that we're both on the same page. So that's how I would compensate for that. Now, if that person always brings stupid ideas and you're like, here we go again, this is the third meeting, and she does not get what I'm going for here, we need to pivot. Because at that point, you don't want to be passing something off to her that you don't feel confident that she can handle. She's always going to be unsuccessful. You're never going to like her ideas. And every time she's going to be like, I keep bringing these ideas and she never goes with them. That actually detracts from what you're trying to do. And so you come up with something that's more important for her to do. Like, you know what? I've been thinking about this a lot. There's this category that I just really feel like I need your support on. You've already got a lot on your plate. I'm going to shift marketing. I really need your help with this. So we position it correctly. We're not like, you were terrible. You had stupid ideas that we never incorporated. So I'm changing your task. We just come up with something better for her to do. So we may have to pivot. If we've wrongly attributed what that person can do, Pivot. Don't just keep banging your head against the wall. And a year later, you're in your 12th marketing meeting. And you're like, I hate this. Call it quits early enough and repurpose her. Yeah.
Love it.
So, directly responsible individuals, key takeaways are if you don't have that in place, start the process of it. And I would say the easiest way to start it is have your team member fill out a questionnaire. What ideas do you have for the practice? What are areas of the practice that you wish you knew more about?
But I think it is also important to ask, do you want to take on more tasks?
Mm-hmm.
Like, do you feel like you are mentally there to and I guess you have to be careful with that too, because if they're always like no and everybody else is, but on the other hand too, then that gives you the answer you need. It doesn't mean that you're not a valuable employee, but it's you've got your plate full, which means you're probably not going to be successful if there's no other area you want to do. And then it doesn't mean everybody else is stuck with these tasks. It's opportunity.
Yeah.
And then that way, too, every time we go over a compensation review, too, it's like, well, what else have you contributed to the practice? You are capped out as high as an RDA in this area gets paid. I can't pay you more than that. That's
right.
But what else can you do?
Yeah.
So I think the ones that are like, no, I don't want to do anything else. And then now they're looking at you going, well, it's been a while since I've had a raise. Well, what else are you adding to the practice? What do you mean? Well, like so-and-so picked up this, so-and-so picked up that. You had your plate full, you weren't ready to pick up anything. And then at that point, they can see and go, yeah, you're right. I don't want to pick up anything else. So I guess I am fine.
Exactly.
Or, oh, you're right. Last year I wasn't, but if that's the way to get a raise, I will free up my time. And these are the things I'm interested in.
Yeah. Yeah. I agree. I think that's a great way to make sure that they actually want the tasks as well.
I almost view it as it's more of a privilege. Like even for our kids at home, like, if you want to be earning, my one wants to earn a MacBook. Okay, well, then what are you doing to earn it?
Yeah.
And so she hates, she doesn't mind laundry. She hates loading the dishwasher. Okay, well, at some point you're going to have to figure out how to load the dishwasher. But for now, that's fine.
Yeah.
But you empty it, you do the laundry.
Mm-hmm. Yeah.
And it's working for now.
Absolutely. Yeah, I think that's the right approach. So I would just start somewhere. And you could even as a practice owner or a leader go, what are the things that I really need to hand off, like that are weighing me down? And you could even say, hey, these are my 3 categories that I need support in. So in that questionnaire that you give out to your team members, do any of these categories, are you curious about any of these categories?
So if I was listening right now, I'd be like, what categories? What are you talking about? Can you maybe make a playbook thing on that? Like things that, because I think for practice owners, at least for me, I'm like, I don't know what I could get off my plate. What are you talking about?
Yeah.
Like what kinds of things? I'm the one who has to do payroll. I'm the one who has to make sure compliance is being met. I'm the one who has to make sure we've got a marketing plan. I'm the one who has to make sure chart notes are done. I'm the like, so I wouldn't even know what categories to consider. So if you could maybe have that, and then maybe can you make a sheet of like, the handout, the questionnaire you could give employees.
Absolutely. Yep. I'm writing both of those down. So
I love when I give Bethany homework. In the office, she gives me homework. And then of course I try to pass it along to somebody in the office to take care of.
So what you're saying is you've outsmarted the system.
I'm the head octopus. I'm a deformed octopus. I actually have 18 arms, not 8.
Oh my gosh. Okay, so go do it. DRI.
Octopi.
Thanks for joining the conversation today. We hope that you are comforted in knowing that you are not alone, but we also hope that you're walking away with some really great tips and tricks to try in your practice. We value your feedback, so please take a few moments to rate and review the podcast. Finally, we want to make sure that we're covering the topics that matter to you. So track us down on Facebook, Instagram, and Twitter, and let us know what topics you want us to cover. As always, please know that we are rooting for you today as you manage your dental drama.